For a long time, getting a COVID-19 vaccine in Canada was, well, pretty simple and totally free. But that's all about to change. Now, depending on where you live, your next shot could actually cost you money, and it's creating this new kind of divide across the country. So let's get into why this is happening.
Yeah, we're really talking about why your next shot might not be free anymore. A literal shot in the wallet for some people. And look, this isn't just some minor policy change. No, this is a pretty fundamental shift in how Canada is starting to manage COVID-19 for the long haul.
Okay, so let's just cut to the chase. The big question on everyone's mind is my next COVID-19 shot going to be free? And the thing is, the answer used to be a super simple yes for pretty much everyone. Not anymore. Now it really, truly depends on your postal code.
You can already see this clear split forming across the country. On one side, you've got provinces like Quebec and Alberta. They're moving to this targeted model where the shot is only free for certain high-risk groups. But then, on the other side, you've got places like Ontario and British Columbia that are, at least for now, sticking with the free-for-all approach. And what that creates is, well, it's a real patchwork of access depending on where you are.
So, the big question is, why now? Why is this all changing? Well, it really boils down to two big things: money and science. Let's dig into the money part first.
Okay, so first up, the money. Ever since 2020, it's been the federal government picking up the tab for all the COVID-19 vaccines. But that's about to stop. Starting in the fall of 2025, that responsibility, and more importantly, the cost, gets handed off to the provinces and territories. And you can bet, as soon as that new expense hits their books, they're all taking a hard look at their vaccination programs.
Now, the other side of this coin is the science, which has obviously evolved a ton. As Quebec's National Director of Public Health, Dr. Luc Boileau, put it, we're just in a completely different world than we were back in 2020. Think about it. Between widespread vaccination and so many people having had COVID already, a huge chunk of the population now has a really high level of immunity. And that just means the risk of getting seriously sick is way, way lower for most healthy people.
And this right here, this really gets to the heart of the big strategic shift. We're basically moving from a pandemic footing, that all-hands-on-deck emergency mode, to an endemic one. The goal isn't eradication anymore, it's about long-term sustainable management. Think of it kind of like how we handled the seasonal flu every single year.
Okay, so if we're treating this more like the flu, then who does the science say should still be getting vaccinated? Well, to figure that out, the provinces are all turning to Canada's top immunization advisory group for some guidance.
And this is it. This is where that guidance comes from. It's the National Advisory Committee on Immunization. You'll hear it called NACI. They're the independent scientific body that provinces basically listen to when they design their health programs. So the big question is, what's their advice now?
All right, so NACI has what they call a strong recommendation for a few key groups. We're talking about all adults 65 and older, residents of long-term care homes, people with underlying medical conditions, pregnant individuals, and of course, our frontline healthcare workers. Basically, it's the people who are still at the highest risk of getting really sick. So what about everyone else? The rest of the healthy population. Well, for them, Nancy's advice is discretionary. That's the key word here. It means the vaccine can be offered, but it's not seen as, essential. And that one little word, discretionary, that's the scientific wiggle room provinces are using to justify their decisions about who has to pay.
But it's not just about the science. There's also a whole bunch of economic data that really points in the exact same direction, a more targeted approach.
Okay, before we dive into the numbers, there's one quick concept we got to get our heads around. It's called cost per QALY, which stands for Quality Adjusted Life Year. It sounds complicated, but all it is, really, is a way for healthcare systems to measure value for money. How much does it cost to give one person one more year of good health? The lower that number, the better the value.
So when you apply that to COVID vaccines, what does the data say? Well, for adults aged 65 and up, giving them an annual shot has a cost per QALY of just over $7,800. Now, in the world of public health, that is an absolute bargain, a super efficient use of our healthcare dollars.
But check this out. What happens if you try to add a second annual dose for that exact same group? The cost per QALY just skyrockets to over $137,000. It's a textbook example of diminishing returns, right? Where every extra thing you do gives you less and less benefit for the cost.
So the takeaway here is pretty clear, right? Both the economic models and the scientific recommendations are all pointing to the exact same conclusion.
Focusing our vaccination programs on the people at the highest risk of severe disease is where you get the most bang for your public health buck.
Okay, so we've talked about the science, we've talked about the economics, but what does this all actually mean for you? When you actually go to get your next shot.
Let's take Quebec as a perfect real-world example of how this plays out. If you're in one of those high-risk groups we talked about, say you're over 65, you have a chronic illness, you're a healthcare worker, your shot is still free, no problem. But what if you're just a healthy adult under 65? Well, then you might have to open your wallet, even if the only reason you want the shot is to protect, say, a vulnerable relative.
And we're not talking about a small amount of money here. The question is, how much is it going to cost? Well, for anyone in Quebec who isn't eligible for a free shot, the price you'd pay out of pocket at a pharmacy is looking to be somewhere between $150 and $180 for a single dose.
As you can imagine, this new patchwork system is already causing a ton of confusion. I saw this question on a Reddit forum, and it just perfectly sums up the situation, especially for people who live near provincial borders. It's a Quebec resident asking basically, hey, can I just drive across the river to Ontario and get a free vaccine instead of paying for one here?
And what's the answer to that? Well, turns out to get a free shot in Ontario, you don't strictly have to live there, but you do need some kind of direct connection. You have to either live in Ontario, work in Ontario, or go to school in Ontario. So yeah, for some people living right on the border, vaccine tourism might actually become a real, practical option. So all of this really leaves us with a huge, fundamental question as we enter this new phase. As public health shifts away from this collective, we're all in this together emergency response and moves towards something that involves individual cost, how do we strike that right balance? The balance between community protection and what we're asking individuals to pay out of their own pocket. Honestly, it's a debate that is really just getting started,